variant continues to make its way through the state. Now, Omicron first arrived in Ohio on the heels of the Delta variant, with its impacts felt first in Northeast Ohio back in December. It didn't take long for Cuyahoga County to soar to the very top of Ohio's weekly case rates per 100,000 residents in mid-December, with more than 1,200 cases per 100,000 residents. Within just 1 week, that number had doubled to more than 2,500 cases per 100,000, and then peaked at over 3,000 cases per 100,000 1 week later. Now, as we enter February, that number has plummeted in Cuyahoga County to 268 cases per 100,000. And Cuyahoga County now has the lowest cases per capita of all of Ohio's 88 counties. This dramatic climb and subsequent fall illustrates the rapid cycle of Omicron. As these cases skyrocketed from mid-December through much of January, record numbers of people headed to the hospital for testing or treatment, crowding emergency rooms and filling our hospitals. Hospitalizations reached a pandemic high of 6,749 patients on January 10th. And thankfully, that number has been falling daily ever since, now at 3,464, which is a 48% drop. Still, a very high and very concerning number. In the last 3 weeks, hospitalizations have declined 65% in the Ohio Hospital Association's Northeast region. Now that's Greater Cleveland. They've declined 60% in their East Central region. That would be the Greater Akron-Canton area, and 44% in the Northwest region. Now that includes Toledo. These were the regions of the state that were first hit the hardest. Hospitalizations are declining in other parts of the state, but they're not dropping as quickly in those other parts yet. Despite these improvements, some Ohio hospitals continue to manage very high hospitalizations for COVID-19, but the ongoing decline in hospitalizations is allowing many hospitals to resume services that needed to be postponed during this most recent surge. Due to the continued extraordinary number of COVID-19 cases, especially in the southern half of the state, many hospitals continue to require the support of the Ohio National Guard, even as other hospitals are now able to transition away from Guard support. The Ohio Hospital Association continues to actively partner with us in surge planning to ensure that healthcare services continue to be responsive to the local needs of each and every one of our communities. So we are feeling hopeful as we begin February that better days are ahead. But remember, we are still a very long way from having case levels like those we were seeing in the late spring through the early fall. Our cases per capita are still, as a state, more than 10 times what is considered high in terms of levels of transmission. Now, as we look forward, there's no crystal ball to tell us what will be coming next. COVID-19 is almost certainly here to stay. So now the question for us is, how do we learn to live with it? And at what point have we moved from something that's truly a pandemic to something that's more endemic? And how do we make that transition in the best way? Joining us today is Dr. Joe Gastaldo, Ohio Health's Medical Director of Infectious Diseases. He's joining us to help us reflect on how far we've come in the last 2 years and what we might expect as we transition from a pandemic footing to one that's a little bit more of an endemic state. Dr. Gastaldo, can you first help explain for us the difference that scientists mean when they talk about something being pandemic versus endemic, and some examples of diseases that people might know that are considered to be endemic diseases?
Yeah, first of all, Dr. Vanderhoff, thanks for having me again. It's my honor to be here and addressing at this press conference. So in the scientific world, we use the word pandemic really to emphasize that it's spread of a disease or an infection in the study of COVID-19 in a population who has no immunity. And when we say the word pandemic, it really is a worldwide phenomenon. And that's really exactly what happened with COVID-19. We had a novel coronavirus appear in our population where nobody in the world had any degree of immunity. So as a result, we had widespread this virus going throughout the world. Now, endemic is a word that we use to describe a disease or infection in this matter that essentially persists in the population indefinitely. Now, in the setting of what this specifically means for the virus, it really means that instead of these big peaks, there is likely to always be a baseline level of some type of infection or activity going on. And it may go up or down based on the seasons. For example, with respiratory viruses like influenza, we typically see them more in the winter months.
Thanks. Now, so thinking about that and thinking about moving from this being pandemic to something more endemic, maybe like influenza, can you share with us some of your thoughts about, well, what are the factors that go into that? How might Omicron have actually played a role in helping us make that shift? How can we think about what leads us from the one state into the other?
Yeah, that's a great question. It's very complicated, but it kind of boils down to this: immunity. The first thing I want to say is the safest way to get exposure and immunity to this virus is vaccine. We now have two vaccines that are fully FDA approved. But nonetheless, through vaccines and people having exposure to this virus in their environment and their day-to-day lives, we are left in the background of more people having various degrees of immunity. Excuse me. And in that context, it's that type of immunity that will give protection to people, most importantly, from severe disease resulting in hospitalization or death.
Thanks. And so extend a little bit more because we've talked a lot about immunity. We've talked a lot about the importance of vaccination in securing that immunity for each and every one of us. But of course, there's also, I think, very valid discussion about natural immunity. And can you share a little bit about the roles that both vaccine-based immunity and immunity that we get from an infection play?
Yeah, that's a great question. Again, it's a complicated question, and it basically boils down to this. Yes, it is true. If somebody does get COVID, most people are left with varying shades or degrees of immunity. And as everybody knows from talking about this, it's very complicated. There's immunity from infection and immunity from severe disease. Now, somebody's immunity that they get from natural infection can be variable from person to person. For example, somebody who is younger is likely to have a better degree of immunity compared to somebody who is older. So immunity that you get is variable. What we do know is that the immunity you get from vaccines is not only better than natural immunity, it is more observable, and it's something that can be studied more in the real world. And we also know too that for somebody who has had COVID, it is safe to vaccinate them. And actually, they are left with what we really call hybrid immunity, which is a better type of immunity than immunity from natural infection or immunity from being vaccinated alone. Nonetheless, it does boil down to what we said before. As time goes on, as more people get vaccinated, as more people get exposed to this virus, in the aftermath of Omicron especially, we are left with more people with degrees of immunity. And again, if you are vaccinated, if you get a booster and you get a post-vaccination infection, and you're home with a cold or mild symptoms, that's the vaccine working.
Thank you so much. Thank you, Dr. Castaldo. Well, for COVID-19 to progress in this evolution to a more endemic illness, one thing's clear from Dr. Castaldo's comments: we need to have enough people who are protected with strong immunity, and vaccinations are clearly a big part of that puzzle. Today, 6.6 million Ohioans, or 60% of eligible Ohioans, are in fact fully vaccinated. 32% of eligible Ohioans are boosted. But that means there are still Ohioans who are eligible, but not yet boosted. As we move forward, we need to continue to see our vaccination numbers rise to boost our state's immunity. Vaccination rates are currently lowest among some of our youngest Ohioans. For example, approximately 47% of those 16 to 17 are fully vaccinated. Approximately 42% of adolescents between 12 and 15 are fully vaccinated. And approximately 19% of children 5 to 11 are fully vaccinated. And only a small fraction of those are now boosted. Further research reported in the CDC's latest Morbidity and Mortality Weekly Report, a regular publication, affirms the importance of getting booster vaccinations. The truth is, you're in a much better spot if you keep your vaccination up to date for COVID-19. And that's especially true if you're over the age of 50. It's clear that there is a real benefit to keeping your vaccine up to date. Getting vaccinated with the primary series is the first and most important step in that journey. Joining us next is Dr. Patty Manning Courtney, Chief of Staff of Cincinnati Children's Hospital, to share some of the trends in COVID-19 cases, children and teens, and what we're doing with vaccinations. So, Dr. Manning, with comparatively lower vaccination rates among children and teens, coupled with a highly contagious variant, how is the Omicron variant impacting our children?
Well, thanks, Dr. Vanderhoff. And as always, it's an honor to be here. I can tell you that Omicron had a significant impact on kids. We saw a dramatic rise in our hospital and in children's hospitals across the state in hospitalized children at the middle to end of December. And previously I had not shared exact numbers of hospitalized children in our institution, but we went from the high teens, low 20s to 30, 40, 50, 60 plus hospitalized children in a matter of weeks. And it was terrifying to see that many children testing positive, coming to the hospital, being ill with COVID. So it had a dramatic impact, as it did on the general population. Children were not spared, even though people think of children as not being impacted by Omicron.
Yeah, thank you for that. Unfortunately, some parents may mistakenly believe that COVID-19 really does not pose much of a risk to their children. We've talked about hospitalization, but of course there are other ongoing risks. Could you outline what those risks are, especially for those who are not yet vaccinated?
So the children who are not yet vaccinated, much like the unvaccinated adults, they're at greatest risk, not just for getting COVID, but for having serious complications from COVID. We know that the vaccine is protective from severe disease. So the children that have been hospitalized across the state are largely unvaccinated. The ones that get the sickest are definitely unvaccinated. And then there are the children who get other complications, like you've heard us talk about, MIS-C. Our colleagues up north in the children's hospitals in the Cleveland and Akron area shared earlier this week on a call that they're seeing expected rises in the cases of MIS-C. This is the post-COVID inflammatory process that we see in children that can be quite severe, can involve the heart. And we're all bracing for those numbers to go up across the state as we have seen these skyrocketing numbers of children with COVID.
What are some of the concerns that parents have raised to you and your colleagues about vaccinating their children for COVID-19? And what would you say is your response or what you'd want them to understand about these vaccines and their safety profile?
So the two concerns that parents raise the most about this vaccine that I hear are, number one, the long-term effects, and number two, some ongoing concern about fertility. To the first concern, I say this: we are so fortunate to know that the way that vaccines work, all vaccines, including the COVID vaccines, that they work quickly and then they're done. And they don't stick around, they don't hang out in your body and cause long-term effects. So even though the COVID vaccine hasn't been around long, other vaccines that are similarly derived have taught us that vaccines don't cause serious long-term effects. What does cause serious long-term effects is COVID. And so I tell families that I'm much more concerned about the long-term effects of an actual COVID infection, even a mild COVID infection. We have seen hundreds of children here at Children's Hospital in our outpatient clinics for ongoing COVID symptoms of fatigue, respiratory issues, some cardiac concerns, some neurologic concerns. That's far more common than any kind of long-term effect from the vaccine. To the fertility question, I say, and this is one of those frustrating issues that where a seed of doubt got planted around this side effect. It's just simply not true. We just haven't seen that. There's no evidence. There's no basis for that concern. And so I'm just simply not concerned about any kind of fertility impact from these vaccines.
So in terms of your experience as providers, as pediatricians administering this vaccine to kids, how would you compare your experience with this vaccine thus far to the many other vaccines that you give?
It's a great question because it's actually very similar. Children are amazingly strong and resilient. They handle the vaccines that we give them regularly and routinely very well, and they've handled the COVID vaccine very well. In fact, you could argue with some evidence that the children have handled the vaccine better than the adults have in terms of side effects and tolerance. So it's been a very similar experience to us, to other vaccines, which makes us, again, as pediatricians, very comfortable making this recommendations. To us is no different than the other really serious illnesses that we ask you to protect your children from by getting them vaccinated.
Thank you. And of course, now we're at roughly 2 years of dealing with this pandemic. What would your message be to parents and in terms of what the best things they can do to be protecting their kids from COVID-19, given the fact that we're saying COVID-19 is probably with us to stay?
Exactly. So COVID is here to stay. And we're so fortunate to have tools that can be protective and can help us learn to live with COVID. So to parents, I say this: if your child can be vaccinated, please vaccinate them. There are so many opportunities to talk to your pediatrician, your primary care provider, whoever your trusted partners are in your child's healthcare. Talk to them. They will encourage you to get your child vaccinated. If your child's too young to be vaccinated, then you've got to continue the safe practices that we've talked about, limiting some exposure to crowds or to people that you don't know their vaccination or illness status, using masks where appropriate. We're also encouraged that the rates of disease are coming down, but as you heard Dr. Vanderhoff say, they're still very high. And so every effort needs to be made to protect the individuals in our lives who are most vulnerable, and those are the unvaccinated, the elderly, the ill.
Thank you, Dr. Manning-Courtney. Now I'd like to share some good news about our efforts to provide access to rapid COVID-19 tests for all Ohioans. The state has purchased and has distributed, or is in the process of distributing, 5.6 million tests. And now we're seeing an increase in the flow of tests to the state. Ohio distributed 875,000 tests in the month of January. Early in the month, when acquiring tests was particularly challenging, the priority was to send tests to our K through 12 schools to help them stay open and to keep our children in the classroom, where, of course, evidence shows they generally do the best. More recently, as supply has begun to improve, the state has been able to send more tests to our community partners, including libraries and community centers. Of the 875,000 tests distributed overall last month, 385,000 were delivered to those partners. Ohio's comprehensive testing strategy has many prongs. Of course, any Ohioan can order up to 4 free tests through the federal government's national initiative. And last week, we announced a partnership with the Rockefeller Foundation called Project ACT. Our partnership with Rockefeller represents an additional opportunity for us to get more tests into Ohio. It's additive to our testing capabilities and complements our other efforts by making up to 175,000 new tests available to some of the most vulnerable areas in the state. We're excited that Ohio is one of only a handful of states that will have this opportunity. And we'll continue to seek out new and innovative ways to meet our state's need for testing in all of our communities. In addition, our department continues to work closely with the Ohio Hospital Association and the Ohio National Guard to support testing sites across the state. The Guard is currently supporting 16 testing locations, and this effort has helped to relieve the burden on emergency departments, as well as to increase access to testing in many communities. Our focus is to continue to evaluate our testing needs and to stay flexible with our distribution strategy in the midst of what has continued to be a very dynamic national situation. Throughout the COVID-19 pandemic, our response has consistently evolved, even as the virus has evolved. And this will continue to be the case as we approach the next phase of our response to COVID-19. Endemic diseases are all around us, from the common cold to the flu. We don't know if or when COVID-19 will join that list, but we do know the continued efforts to reduce the spread of this virus and to increase immunity are critical to getting us there. Now, vaccination remains more important than ever. Now that the two messenger RNA vaccines, those from Pfizer and Moderna, have both received full approval by the US Food and Drug Administration, Ohioans should feel an added layer of confidence in their choice to get vaccinated. Earlier this week, the US Food and Drug Administration granted full approval for the Moderna COVID-19 vaccine for people ages 18 and older. This is the second COVID-19 vaccine to receive full FDA approval. The Pfizer vaccine received its approval last August. Moderna's FDA approval is another milestone in our ongoing fight against COVID-19. The Moderna COVID-19 vaccine meets the FDA's high standards for safety, effectiveness, and reliable manufacturing quality, features required of any vaccine to receive approval for use in the United States. More than 200 million doses of the Moderna vaccine have in fact been administered in the United States, including more than 6.3 million doses right here in Ohio. Staying up to date on COVID-19 vaccinations, including getting a booster when eligible, is the best defense that any of us have against COVID-19. Remember, children ages 5 to 11 can get a version of the Pfizer vaccine that has been formulated just for kids. And children 12 and older can receive the primary vaccination series plus a booster. While children are less likely than adults to get severely ill from COVID-19, as our guests have shared today, they are certainly not invulnerable. Children get sick from COVID-19. They can spread it to others, and some, sadly, will suffer severe health outcomes from COVID. Getting vaccinated against COVID-19 can lower your risk of getting and spreading the virus that causes COVID-19. Vaccines can also help prevent you from having serious illness and, of course, death. All steps have been taken to ensure that our vaccines are safe and effective for people who are receiving them. Protect yourselves and your families from what is still to come. If you've not yet been vaccinated, please talk to your doctor or healthcare provider and get the facts, and then choose to be vaccinated. Thank you. And now, Michelle, I think we can open up for media questions.
Thank you, Dr. Vanderhoff. Our first question today is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors, for doing this today. Good morning. I want to ask a question. We have a lot of people who, during the last month and a half, they've had a really difficult time trying to get tested when they had COVID. So they just assumed that they had COVID if they had cold symptoms and went ahead with it. But now they're asking, is there a way that they can find out? They just want to know if they've had it and, if they have any antibody to it. What about that? Is there a way they can find that out? Do you recommend it, and how to deal with that?
I'll start and then I'll turn to my physician colleagues, especially Dr. Gastaldo, who's an infectious disease specialist. The short answer is, unfortunately, we really don't have a reliable, great way right now of assessing your level of post-infection immunity. I think many of us would, of course, like to have that capability, but the antibody tests that can be done for some fairly complex reasons are really not designed to do that. And so let me segue to Dr. Gastaldo, who knows a great deal about this topic. Dr. Gastaldo, could you elaborate?
Yeah, and you know what, Bruce, that's Dr. Vanderhoff, that's a great question. And we deal with that every year. And I remember even before COVID, in the setting of influenza, when influenza rates are so high and somebody has an influenza-like illness, it is safe to say that, yes, you do have flu. And in that same context, in the Omicron surge, if somebody does have symptoms suggestive of Omicron and they cannot get tested, knowing how contagious it is and how high the numbers are in the community, it is safe to say somebody does have Omicron. That's actually been the guidance, is to behave that way as far as your isolation. When it comes to antibody tests, there are certain circumstances when we do antibody tests on people, and sometimes that could be used as a clue to let somebody know that they have had COVID. But nonetheless, though, we do not want to use antibody tests as any type of decision in receiving a vaccine or a booster. The antibody tests all perform a little bit differently, and I could tell you anecdotally in patients that I've taken care of, I've had antibody tests done at different labs, and they say different things. So we really don't want to have anybody make any decisions about a vaccine or a booster in the context of an antibody test result.
Thank you. Our next question is from Dan DeRose with WOIO.
Again, thanks for the access, as always, doctors. Dr. Vanderhoff, aside from saying, yes, we saw Omicron in other countries, we kind of knew that it was going to come in and do this. Can I just get your personal take at just how sweeping Omicron was, especially here in Northeast Ohio? In a 6-week span, Cuyahoga County went from lowest per 100,000 in the state to highest 100,000 in the state to back to lowest in the span of about 6 weeks. That's more than a blizzard, a wildfire. How does that hit you overall when you start taking a step back and looking at just what Omicron did to us?
Thank you for that question, Dan. It is a reflection of just how incredibly contagious the Omicron variant has proven to be. We said as we saw Omicron emerging in other parts of the world, that it appeared to be so highly contagious that there was every reason to believe that anyone who was not very well protected with up-to-date vaccine-based immunity was at real risk for getting the virus. And if you just look at the numbers, the sheer numbers, and the speed with which those numbers rose and now are beginning to fall, that observation has proven to be true. Omicron has demonstrated that the virus that causes COVID-19 has now changed. It's evolved into one that is very, very contagious. And we have other diseases that are respiratory diseases that are very, very contagious, like the common cold. And in fact, there are forms of the cold that are actually caused by cousins of SARS-CoV-2, the coronavirus that causes COVID. Let me segue on that to my two colleagues. I think I'll start first again with Dr. Gastaldo, simply because he's an infectious disease doctor, and then turn to Dr. Manning Courtney. Dr. Gastaldo, what would you say in follow-up to that?
Yeah, so Dr. Vanderhoff, you're exactly right. I would describe the Omicron variant really as a tsunami. And like you said before, it is very, very contagious. And as quickly as it came on, it is actually going away just as quickly. And, we have to be open and honest with the people too. This virus is very wily. Nobody can safely predict what's going to happen. We need to be on the lookout, obviously, for other types of variants. And although it's not yet been identified, the next letter in the Greek alphabet is pi. And someday there will likely be a pi variant. But again, we need to have the infrastructure in place to identify variants and then study them. When we have a new variant, we want to know, is it more transmissible? Is it associated with a higher severity of illness? Do our vaccines and our other therapeutics still work against it? And moving forward, that's what's happening now worldwide and in our nation, is this infrastructure being built slowly to have mechanisms in place to allow us to live safely with this virus. And despite the potential for a more sinister variant in the future, we are in a much different place today in 2022, knowing what we know and really building that critical infrastructure.
Dr. Manning?
Well, yes, maybe the appropriate adjective or descriptor to use today is that it was a blizzard of disease that struck us, struck children. And the only thing that I would add is that when you have such dramatically, rapidly rising numbers of ill people, even if the illness is relatively mild for the majority of people, it's always not mild for a percentage of people. And even if that percentage is low, if the number of people is dramatically increased in a short period of time, the risk of overwhelming our healthcare systems is so high. We all lived through that. You've heard us say it many times as healthcare workers, and we beg you always to help us not have that happen because it affects the care of everyone. And so while we're greatly relieved that the numbers are coming down as rapidly as they are, none of us want to live through another blizzard of a variant like that.
Thank you. Our next question is from Danny Eldridge with Hannah News Service.
Hello, doctors. Thanks for your time today. So I'm actually curious about what kind of effect might this, winter weather we're having have on reducing transmission. A lot of people are, being forced to stay home. So I don't know. Are you optimistic that this could help reduce transmission rates and reduce case numbers, et cetera?
I'll start and then again turn to my colleagues. One of the things that is interesting about many respiratory viruses is that we actually find that those respiratory viruses are more prevalent during the cold winter months, times when people are spending a lot of time indoors. And while I'm sure that for the day or two that people are not moving about outside of their houses, there could be a modest impact. The reality is we are in the season of the year when typically respiratory viruses, which SARS-CoV-2 is a respiratory virus, usually spread the best. The environmental features are perfect for that. And the fact that people are in indoor spaces as opposed to outdoor much of the time also contribute to it. So I actually don't expect that the couple days that the severe winter storm has impacted us will have much of an impact, other than it might have a impact on the testing for the couple of days. For example, I know that many testing sites across the state, because of the weather, are not able to either be open or to process as many people as they might otherwise, and fewer people are showing up to places. So we could see some dip and for a couple of days in our testing numbers, but in the big picture, I think this is just going to be a blip. I'll turn to my colleagues.
You're exactly on point, Dr. Vanderhoff. We see more respiratory virus infections in the winter months because we are all indoors where there is suboptimal ventilation of air. Outdoors is always safer than indoors as far as respiratory viruses go. But in the context of being indoors with other people, I really want to understand individually what's the degree of immunity that people have. If you're indoors, other people who are fully vaccinated versus maybe children or immunocompromised people in the house who are not vaccinated or have a suboptimal response to vaccines. That's part of the communication and education we need to really get out there to people in the public. Being indoors is a riskier scenario if you are going to be indoors mixing and matching unvaccinated and vaccinated people. That's the riskier scenario.
Our next question is from Pete Grieve with Spectrum News.
Good morning. I'm wondering if you could sort of contextualize at all January's COVID-19 death numbers, because if you look at the CDC data, it appears as if it was the deadliest month of the pandemic. But then obviously last year there was that issue in the winter where several thousand deaths were reported a little bit later. So just wondering if you could sort of put that in context for us.
Yeah, thank you. That's a really, really good question. It's a somewhat complex question, but let me unpack it if I can. So if we look at the data posted nationally, Ohio actually ranks about 24th out of the 50 states, so right in the middle, according to New York Times death per capita data from the beginning of the pandemic. Ohio's daily death average in December 2021, so December that we just got through, which is the latest month for which we have fairly complete numbers, was 112 per day. Now, there are some complexities in comparing death data across states using the measure that they use, which is death in the last 7 days, because different processes and reporting lags for deaths are present in all the states across the nation. So any estimation or ranking of states by very recent death counts is somewhat fraught. Really, we have to think of these numbers over a longer window, and 7 days is kind of a challenging window with which to look at the number. For background, Ohio's death reporting is based on the date of death for Ohio residents. And that's a difference also because the New York Times data that people refer to when they compare nationally appears to be on the basis of date reported. So Ohio's method of reporting mortality data uses something called the Electronic Death Registration System, EDRS, and it's information from death certificates coded by the National Center for Health Statistics. That methodology verifies the death was in fact a result of COVID-19, and that's considered to be the gold standard for accurate death reporting. It's a process that we use to ensure that, for example, someone who is in a fatal car accident but happened to test positive for COVID isn't inaccurately counted as a death caused by COVID. So the EDRS death data is a very reliable, dependable one, and it is what we rely on. So as a result of the complexity of that reporting process, our death data is not reported daily, but rather twice a week on Tuesdays and Fridays. So on dates that the data is not reported to the Ohio Department of Health, our death data remains static on our dashboards. So it's also important to note that because the data lags, we could learn months later of a death caused by COVID-19. So that's a little bit of the complexity of the background of the reporting. It's then also worth noting that Omicron hit us in Ohio earlier than it hit many other states, especially up in the Cleveland area. And so we're starting to see those deaths influencing our overall numbers. And it probably a little bit before many other states are seeing that impact. So in total, according to the Ohio Department of Health data, Ohio has right now more than 33,000 total reported deaths during the pandemic as of yesterday. So that's kind of the picture, very complex, but in a nutshell, when we're looking at death data, I wouldn't pay too much attention to these 7-day intervals that often are what you see on the national maps and comparisons. We really need to look at it over the longer haul. And over the long picture, it appears that Ohio is about in the middle in terms of overall deaths from this terrible virus.
Thank you. Our next question is from Lisa Ryan with IdeaStream Public Media.
Hi, thank you. Not everyone is wearing masks in public, but for those who are, the people trying to stay safe, when can they stop wearing a mask in public? Is there something that they can look for to know it's safe to take their mask off?
That's a great question. And one thing that I think we have to consider is context. So as each of us is looking at the risks of either getting or sharing COVID-19 with others, getting it from them, or unfortunately, inadvertently giving it to other people, and we're thinking about masking, we have to think about the context, what's going on in the environment, and what is my personal situation. Certainly, being up to date with vaccination is something that puts you in a much more favorable position in terms of your risk and the risk you pose to others. But also what's important is what kind of environment are you in? So if you're out of doors, and particularly you're out of doors and you're up to date with vaccine, there's very, very little risk of transmitting or receiving the virus. You move into an indoor environment, especially a crowded indoor environment, given the high numbers that we still have. Let's remember, we're still talking about high numbers in every part of the state. There is some risk, and therefore masking is something that we are recommending. At some point, we'll be able to look and say the combination of the trend of our case numbers and the trend of our hospitalizations is pointing toward not only decreases, but likely very low rates of transmission of this virus. And in that situation, I think we can begin to say, all right, the benefit of the mask is probably not enough to warrant the inconvenience. But frankly, I don't think we're there yet. Let me ask my two colleagues. They are in the front lines of healthcare delivery for their opinions.
Yeah, thank you, Dr. Vanderhoff. And you're right on point with how you responded to it. It really bases individually on your risk of getting COVID and having a bad outcome. Have you been vaccinated? Are you a type of person where vaccines don't work as well, like being elderly or immunocompromised? But more importantly, something that I often refer the public and patients to is the CDC website, where they give you levels of community transmission. And in the state of Ohio, for example, all 88 counties are a high-level community transmission, and that's based on COVID cases per 100,000 population. So in the context, hopefully, of what may happen this spring or summer, where we get to lower levels of community transmission, and you are healthier, you are up to date on your vaccines, I think in that individual context, that's a scenario where it's probably safe not to wear a mask in public indoors. But again, we're not at that point yet. We still have high levels of community transmission in the state of Ohio. And that's something that I usually talk about individually with people. It's full of caveats. But right now, for the time being, even with our numbers coming down, it is the recommendation for everybody, regardless of their vaccination status, to wear a mask indoors in the public.
Thank you, Dr. Gustado. Our final question today is from Sarah Shookman with WKYC.
Good morning. I know we have talked a lot about cases in children this morning. I just wanted to ask you, as you're watching decisions being made at the national level about vaccinating the youngest populations among us, I think parents with those under 5 have felt somewhat left behind and stuck without that option. And are you hopeful that that may be a choice sooner rather than later?
Well, thank you for that question. I think that we have looked forward to the day when all of our children 2 and up would be eligible for protection from this virus with the vaccine. And so I'm encouraged by the fact that Pfizer has submitted its application and that the FDA has set a meeting date for the advisory committee to look at this later this month. And I'm fully anticipating that if their review of the primary data is favorable, that then the subsequent process of turning to the ACIP and the CDC will be quick thereafter. But we have to wait and see. The very rigorous medical and scientific approach that has been taken to these vaccines has been the key to their success. And just as we've been rigorous in looking at all the other populations to date, I think applying the same rigor to our children 2 to 5 years old is equally important. And so I'm really pleased to see that kind of rigor is a part of the process. But there's no doubt that there's going to be real benefit in being able to protect the youngest of our children. And while their overall frequency of developing serious illness is less than older people, as we've shared over and over, they're not immune from the negative impacts of this terrible disease. And let me turn to Dr. Manning Courtney, because she's a pediatrician and her institution has been involved in vaccine work, to see what her thoughts might be.
Well, of course, as pediatricians, we are very excited about the option and the opportunity to vaccinate younger children, seeing the impact that this virus can have on them. As I've said, we've had very young children and babies hospitalized regularly, continually throughout the pandemic. And so we want to afford them the protection that other children and adults have been afforded. And here at Cincinnati Children's, we've had the wonderful opportunity to take a very active and leadership role in these vaccine trials. And so I can attest to the rigor and the thoroughness with which these trials are occurring, and the attention to safety that is just paramount for this type of work. I also anticipate, as do my pediatrician colleagues, that with younger children, there'll be both a mix of enthusiasm from the families who are eagerly awaiting the chance to protect their children, and then, a group of parents who are more hesitant because these are even younger children now, who, for whom parents have to think about the decisions about vaccination. And so we really want to do everything in our power as pediatricians and healthcare providers in the pediatric space to reassure parents that this is a safe and effective way to protect their children from this virus, and to help us end this pandemic. Vaccinating and protecting as many people as possible decreases the circulation of this virus, the opportunity for variant development, and children play an important role in that.
Thank you to all of our guests today. Dr. Vanderhoff, do you and our two guests today have any closing remarks to share?
I just want to thank my guests again for joining us. I also want to thank the members of the press for your good questions and your interest in our work to address COVID-19 for the people of Ohio. And please stay safe out there today as we continue to deal with the winter weather. Thank you.
This concludes today's press conference. Thank you again for joining us.
Good morning, and thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 1 hour. If there are remaining questions in the queue when we conclude, and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. Thank you. Thanks again for joining us. We will begin in just a few moments after we grant recording permissions.